All right, so now you're going to put the cold air cooling on there.
Okay.
You're in charge of that. One of the things that we find is that when the patient's in charge of running the cold air, number one, they know exactly where they need the cold air, and number two, it's also very distracting. They're not thinking so much about the laser, but they're actually involved in the process. So we find that getting them involved by handing them the end of the Zimmer hose, it really helps mitigate pain and psychological concern about pain. So, all right, so we have this set up. We're using the 1064. We're going to do a test spot. We're going to try right here, perpendicular to skin. 3, 2, 1. How's that?
I can handle that.
Okay. So one of the things that's really interesting here is you'll see that we're using the 1064 wavelength. That 1064 on the outline where we'd expect was incredibly well absorbed, the black outline of the palm tree. The inner part of the tree, which was filled with green, which would really be best absorbed by a 694 ruby wavelength, you can tell that it's still almost untouched ink. And so that's the thing that's, why it's so important to have multiple wavelengths when you're doing tattoo removal, because you really need those multiple wavelengths to get all the colors of the ink. Okay? Now what we did get is we're going to try and we're going to go over the whole thing because we got the type of reaction we're looking for. We got a nice frosting, not too much, just a little bit of raised tissue, but that's really the sort of treatment that we're looking for. So what we're going to do now is, now that we've done one test spot, the patient survived, we're going to go back and we got the sort of treatment result that we're looking for. I'm going to go back to 10 hertz or 10 pulses per second, and we're going to try to go through this entire tattoo, probably in less than a minute. Now what we're going to see is there are going to be areas that, just like this, frost up and get the perfect reaction, and then there's going to be areas in between, like the red ink in between, the yellow ink over here, and some of the green ink in the palm tree, that we probably don't see quite the reaction. But again, this is her first treatment, and really what we're looking for is to peel back the layers of the onion, get that black ink out, get down to the purest inks of green, red, yellow, and then next time we'll probably look at using different wavelengths. I'm going to try to not have as much overlap, so I'm going to move fast, so we don't have to do too many treatments. All right, you ready, Jesse?
Yep.
3, 2, 1. How we doing?
Good.
Painful?
Yep.
How was that?
It hurt.
It hurt,
but I'm good.
but I mean, the whole treatment was less than a minute, and you can see, really where we got a good result, where we got great. You could hear the snap. It frosted up, but not too much. And even though we went over this green ink in between, we didn't get much of a reaction. Now, what I could do is I could go back to our 694 wavelength, the ruby wavelength, and specifically get some of those green spots. Again, because we didn't over-treat at this point in time, I'm probably comfortable doing that. Are you all right to take a few more spots? Okay. We're going to go back and just hit some of these green areas here with the 694. 3, 2, 1.